Hello friends, today we are going to discuss about primary care psychiatry. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I'll be discussing about what is primary care psychiatry, why should a doctor should learn about psychiatry, and what are the challenges in training and also providing psychiatric care in the community. Let's understand what is primary health care. The term primary care or primary health care means the provision of health care at first contact and for continuity of care which will be near to their home. That means it is PHC. Patients usually contact their nearby healthcare provider for the treatment. Either it can be public or private. Invariably, in a welfare society, it is the government which takes care of the health. The concept of primary health care has been repeatedly, the definition has been changed, redefined, reinterpreted from 1978. Hence, there have been number of various definitions of primary health care. Ultimately, World Health Organization has come up with one more definition. The PHC means, as per WHO, it is a whole society approach to health that aims at ensuring the highest possible level of health and well-being and their equitable distribution by focusing on people's need and as early as possible along the continuum from the health promotion and disease prevention to treatment, rehabilitation and palliative care, and as close as feasible to people's everyday environment. That means providing treatment, rehabilitation, prevention and promotion within the community is the goal of primary health care. So let's understand what is primary care psychiatry here. The primary care psychiatry here is providing psychiatric care within the community, nearest to the home. Here the involvement of well-being is there, prevention, promotion, early detection, treatment, rehabilitation within the community. That is primary care psychiatry, my dear friends. In this regard, we should know what is the burden of mental illness on our society. In this regard, there was a national mental health survey conducted by Government of India by the Ministry of Health and Family Welfare in 2014 and 16. This study was carried out by National Institute of Mental Health and Neuroscience, Bangalore. In short, it is called as NIMANS. NIMANS carried out this study across 43 districts, 80 taluks in 12 states. Here it was 720 clusters were taken. The total sample size was 39,532 individuals were screened and also diagnosed for mental illness. And ultimately, the study report came as lifetime prevalence of mental illness was 13.7% and cross-sectional prevalence of mental illness was 10.6% and severe mental disorder was 0.8%. So this is the current morbidity which was seen between 2014 and 16. This was pre-COVID era. Let's understand by looking into this diagram. Total mental health morbidity in a given time is 10.6%. Common mental disorder is 10%. 0.8% will be severe mental disorder. Severe mental disorder is very easy to diagnose. Even a person who is not educated, even 10th standard fail, can diagnose a person with severe mental disorder. If you go to any village and talk to the elders of the village, they will be able to name the people who have severe mental disorders. Whereas the problem comes is common mental disorders such as depression, anxiety, somatization, alcohol dependence syndrome, tobacco dependence syndrome, cannabis. So these are the disorders where the people look normal, but they are suffering from inside. That's where the common mental disorder plays a crucial role, and it is very difficult to diagnose and also to start treatment for those people. By looking at the overall Indian population, that is, we have 140 crore population approximately, 10% of the population is suffering from psychiatric illness, means 14 crore. Severe mental disorder is 0.8%, that is 1 crore. So, ladies and gentlemen, we have 1 crore population having severe mental disorder and 14 crore psychiatric morbidity who require professional help. But unfortunately, 70 to 80% of them are not on treatment. That is the saddest part. If you look at the alcohol use disorder, 86% of them, they are not on treatment. That means treatment gap is huge. Only 10 to 15% go to doctor, take medication regularly. Remaining almost 85% don't take treatment. That is unfortunate. They continue to suffer. They will have economical problem, social problem, stigma, discrimination continues to exist. At the same time, there was one more study, that was magnitude of substance use in India. This was the study commissioned by Ministry of Social Justice and Empowerment from the Government of India. And the study was also titled as National Survey on Extent and Pattern of Substance Use in India. This was executed by All India Institute of Medical Science, Delhi. And here, the number of sample size was also huge. 2,111 people were surveyed, that is, households were surveyed. 186 districts were covered. And if you look at the total number of individuals, it is 4,73,569 individuals, my dear friends. It's a huge study across the globe. What is the result of this study? The result of this study was stunning. It reported 5.7 crore people having problematic alcohol usage and 2.9 crore people are dependent on alcohol. That means they are addicted to alcohol. 2.9 crore. It is just not 2.9 crore, it is 2.9 crore families are suffering. Imagine the father who is drinking alcohol almost daily and is addicted to it. The whole family will suffer because of that. That means it has a huge morbidity on the society. And it's not a small number, 2.7%, that means 2.9 crore people. So moving to cannabis, here also it says 72 lakh people are problematic cannabis user. That means they use cannabis, they become intoxicated, they enter into conflict with law, fighting with other people. The people dependent are 25 lakh people are dependent on cannabis. That means 25 lakh are addicted to cannabis. Let's look into opioid use. Here the opioid is morphine, heroin, those are the drugs. Here if you look at that, 2.3 crore people are users, 77 lakh are problematic user, and 28 lakh people are addicted to opioid. It is a very serious health problem and this need to be addressed at the earliest. Moving to the next, inhalant, also called as solvent abuse. It is done by children and adolescents. And the numbers are mind-boggling. 8.5 lakh children are dependent or addicted to solvent abuse. It is not just few hundred or thousands. 8.5 lakh children addicted to solvent such as Erasex, petrol, Vicks, and various other materials. They become hooked onto it. Other drugs like cocaine, 3.2 lakh, 7 lakhs amphetamine, 3.4 lakh hallucinogens. That means we have a huge public health crisis at this point of time. This survey clearly said that 2.9 crore people are alcohol dependent or addicted, 0.8 crore are having illicit drug dependence. That means they are regulated drugs. And in total, we are talking about 3.7 crore individuals requiring health professionals' support. It is not just 3.7 crore. I'm talking about 3.7 families suffering because of substance use. Now, let's move on to the children and adolescent. Because in India, 40% of our population are children. That amounts to 48 crore population, children and adolescents, that is below 18 years. There was a study conducted by Savita Malhotra which looked into the prevalence of mental illness in child and adolescent psychiatric population. That is basically below 18. What is the psychiatric prevalence? And this was a meta-analysis of 16 community-based studies. The community-based studies reported in their meta-analysis 6.5% of children and adolescents have one or the other psychiatric comorbidity. That means if you look at the mental illness, 48 crore is the general population, 6.5% is the psychiatric morbidity, that equates to 3 crore. So ladies and gentlemen, we have children who are requiring professional help. Now let's move into the geriatric population, that is the senior citizens above the age of 60 years. The population of senior citizen is approximately 9%. That means 12 crore population. In that, 10% of them have one or the other psychiatric morbidity, commonly is depression and anxiety. That amounts to 1.2 crore. That is, geriatric population is 12 crore. In that, 10% means 1.2 crore people are suffering from mental illness, especially the senior citizens. Let's look into the suicide and attempted suicide. As per National Crime Records Bureau 2022, recently report was released. As per this report, in 2021, 1,64,033 death by suicide was reported. These are all reported suicides. At the same time, there were 450 completed suicide per day. Numbers are mind-boggling, my dear friends. As per this report, every hour there are 18 deaths by suicide. Approximately for every 200 seconds, there is one death by suicide. It is a public emergency if you ask me. But at the same time, as per World Health Organization has said, for every completed death by suicide, there are 20 attempted suicide and failed. So if you look at that number, we have 1,64,033 death by suicide into 20. That means 32.8 lakh people attempt suicide. So it is really heartbreaking to see these numbers. Now the question comes, why are you lecturing me? I am a primary care doctor. I am just a ASHA worker. I am just a community health care worker. What can I do? How can I deal this situation? If you look into psychiatric morbidity in primary healthcare center, many of our doctors will say, sir, we don't see any psychiatric case in primary healthcare center. But studies across the world, across the globe, even in India, they clearly says 25 to 35% of the patient reporting to primary healthcare center or community health center or district hospital have one or the other psychiatric illness. It can be comorbid with physical illness such as diabetes, hypertension, maybe even cancer. So psychiatric illness will come along with them. Persons with mental illness visit primary healthcare center 3 times the general population. They want relief. So invariably in a week, they will visit PHC 3 to 4 times. Psychiatric disorder may complicate the course of coexisting mental illness has been proved beyond doubt. That means if a person has hypertension and also depression, here the depression will have pathophysiological effect on hypertension or diabetes. Depression has been identified as an independent risk factor for sudden cardiac death in patients who have suffered recent myocardial infarction. And again, despite the higher prevalence of mental illness, morbidity, cost, unfortunately, psychiatric illnesses are underdiagnosed, untreated in primary healthcare center. But however, Persons with mental illness also experience greater morbidity and functional impairment than their counterpart. It is not just a mental illness. It will affect their social life, occupational life, family life, and also the community living. Actually, these patients will be wrongly treated with analgesics, multivitamins, benzodiazepines, injections, IV fluids, excessive investigation, CT scan, MRI, excessive blood test, doctor shopping. Because of this, it will be a huge economic burden on the patient and the patient families. And if I talk to the economic burden of psychiatric illness in terms of loss of productivity, that means he doesn't go to job. At the same time, one more person has to stay with him. And if they have to go to hospital, the other person has to accompany with them. And they have to travel. Two people's wages is lost. They have to buy the medicine. They have to pay the doctor fees. And they have to come back. And during the travel, they need to eat food. And they have to stay back. Again, the additional cost will be there. That means it will be very costly for the persons with mental illness and their family for accessing and having a affordable treatment. What about psychiatric illness and premature mortality? Studies have clearly said that if a person has cardiac illness such as myocardial infarction and he also has anxiety disorder or else depression, there is high possibility he is going to die. That means comparing a patient with myocardial infarction without depression and with the depression. The patients with myocardial infarction with the depression has 2 to 4 times mortality than without having depression. That means brain and body is connected. That is, mind-body connection is well established. Hence, they play a crucial role. Presence of mental illness. That means those people who are suffering from mental illness die 10 years prematurely than the normal population. So, think about 10 years of their life is deleted. So, if you look at this diagram as per CDC of USA, it clearly says if a person has stroke, heart failure, cardiovascular disease, metabolic disease, coronary artery blockage, that will cause anxiety. It may cause depression, chronic stress, or PTSD. And that in turn will again cause stroke, heart failure. That means it is a vicious cycle. We need to address here. We need to treat this anxiety, depression, chronic stress need to be addressed. Otherwise, mortality is guaranteed. Further, if you look at the psychiatric comorbidity with other physical illness like cardiac illness, 35 to 40%, endocrinological disorders like diabetes mellitus, 20 to 45%, cancer, 45 to 55%, renal disease, 35 to 45% of them have one or the other psychiatric illness along with the physical illness. To summarize, my dear friends, pre-COVID era reported clearly 10% of our population require mental health care. That is 14 crore population. These are preliminary reports. But however, COVID and post-COVID, we do not know what is the mental health impact and scenario. Slowly, there are studies are coming up. They are saying depression, anxiety is increasing phenomenally. That means no more this 10% will be the yardstick. It may increase the twice or thrice. We have to wait and watch. This COVID has given a challenge to the humanity, not only for physical health, but also to the mental health. It also has created more people with internet addiction, pornography addiction, gaming, gambling. That means non-substance dependence, that is, internet addiction has become very common, especially in children and adolescents. Financial loss leading to depression, job loss, livelihood loss, domestic violence because they are all inside the house, relationship issues, and especially with regard to children and adolescents going to school or colleges, their life was almost stand to nil. That means it was almost came to an end. Wherever there was internet, the schools and colleges were there. Wherever there was no access to internet, there was no school or college. We are going to see more number of female children dropping out of school because of the financial issues. Death of a family member because of COVID, unresolved grief need to be addressed. Relapse of symptoms in pre-existing mental illness is very common, and also precipitating of psychiatric illness in vulnerable population is well known in this situation. So what are the challenges now? We know the problem is huge, and this problem is going to increase post-COVID. Now let's prepare. To prepare, what are the challenges we are going to find ourselves, especially with regard to providing mental health services? First and the foremost is awareness regarding mental health is very, very minimal in our India. Even the doctors, nurses do not know about mental illness. And also they say, why do you take medication? You are not weak. Snap it off. You are strong. These kinds of words will not help them. It will cause them more depression. At the same time, access to mental health care is also very poor. That means they do not get access to the psychiatrist. Even if they get access to the psychiatrist, affordability of a psychiatrist consultation and buying medication is also costly for many patients in India. Along with this, stigma and discrimination. If I go and meet a psychiatrist, what will the people say? He may not get a job, or she may not get married. What will the relatives think? These kinds of stigma and discrimination keeps the patient away from help-seeking behavior. And psychiatric treatment requires long-term treatment. That is, from months to years, the treatment is required. Further, poor knowledge, stopping medicine. Many of the pharmacists will say, why do you take this medicine? They are addictive in nature because of this stigma and discrimination. Many of the doctors will also say, stop the medication, especially psychiatric medication. Unfortunate. Further, the most difficult scenario or a challenge is lack of trained human resources. Let's discuss about psychiatrists. In India at this point of time, we have only 10,000 psychiatrists. Number of patients who needs consultation is 14 crore. That means if you divide 14 crore people who are mentally ill by 10,000 psychiatrists, that means each psychiatrist will get 14,000 patients. Think about this number. Each psychiatrist need to see 14,000 patients. How often we should see them? Monthly once? 2 months once? Yearly once? With 10,000 psychiatrists, we will not be able to do any justice. Hence, what is the number of psychiatrists required? At this point of time, as per developed countries like US and Canada, we require at least 1 lakh psychiatrists to treat this 14 crore population of mentally ill. That will equates to, for every 1 psychiatrist, there will be 1,400 patients. That is the number. That means we have 10,000, we require 90,000 more psychiatrists. But unfortunately, we produce 1,000 psychiatrists per year. To reach 1 lakh, we require 100 years, provided our population doesn't increase and none of the psychiatrists die. Think about these numbers. It is very difficult to digest. At the same time, if we are able to get good number of psychiatrists, do you think they are going to work in rural area? They will work in tehsil area? No. The more you study, the more you get educated, you move away from the grassroots. That is the reality or logic of life. The less you are studied, the more help you will give. Or else the best way I can put across is Mother Teresa's logic. The less you have, the more you give. That is the power of love. Unfortunately, we get highly educated and we don't serve in the rural area. We serve in cosmopolitan or metropolitan cities because we are highly educated. So, what is the answer for this? And we have 45,000 psychiatric beds in mental hospitals. If you take medical college and district hospitals, approximately 20,000. Private hospital maybe 25,000. Totally, we have 90,000 psychiatric beds in our country, and that is for 1 crore severely ill patients. Think about this number: 90,000 versus 1 crore severely mentally ill. And again, in 90,000 beds, most of them are occupied by severely mentally ill or long-standing ill, and also persons with mental retardation. Many of them are abandoned and they are looked after by the state government. That means we are not having access to all 90,000 beds. Most of them are filled with chronically mentally ill patients. This is again, we need to re-strategize our approach to mental illness. So what should be done? What is the answer for this mammoth problem? First, we need to train all the healthcare professionals across public sector and private sector. We need to train pediatrician, especially in child and adolescent mental health. Especially in gynecologist, we need to train about perinatal depression and psychosis. In oncology, we need to train them about grief, depression, and substance-induced various other problems. That means we have a huge role to play. We need to train them in identifying these mental illness, giving first line of treatment. If they don't improve, referral to a psychiatrist, and if the psychiatrist has given the medication, to do the follow-up. So these are the important 4 ingredients need to be taught to all doctors in India. Further, we need to give treatment in the community, not in the hospital. We need to treat the patient in wellness center nearest to the house and also in primary healthcare center, so that the patient need not travel for long duration, also have to pay a huge amount for traveling. So we need to provide community treatment. That means treatment at the doorstep should be the goal. As in COVID, earlier when they started treating them in the hospitals, anybody who is COVID positives were taken to the hospital and quarantined. What happened? Within no time, there were no beds available. And in the second and third wave, we learned that we can manage them at home. So here in psychiatry, we need to treat this patient inside the home, inside the community, not in the hospital. Hospital treatment will be very costly. But at the same time, treating them in a community reduces the human rights violation. Access to treatment will be easy. Some family members will look after them. At the same time, they are in their environment. Hence, rehabilitation can be started at the earliest. So we need to prepare the staff in community health center, primary health center and wellness center, and we need to train them in mental illness. We need to leverage digital technology like telemedicine so that the last person in the last village of the last mile can be accessed and treated using telemedicine. At the same time, we need to start using drug card similar to HIV drug card, so that if the patient is diagnosed with severe mental illness, the medicine every month should reach his doorsteps. Recently, there was a mental health report by the WHO. They clearly said that treatment as usual is not going to help in mental illness. All stakeholders and state government should make a proactive steps to reach out to those patients who are in the community who are not on treatment. That means everyone should take a proactive role to treat a person with mental illness. To conclude, my dear friends, there is no health without mental health. Hence, we need to train all our doctors in mental health and psychiatry. That means we were supposed to learn in undergraduate, especially in MBBS. Unfortunately, the training in MBBS with regard to psychiatry is very minimal. Hence, we need to train all MBBS doctors across India with regard to psychiatry. What do we train them? We need to train them in diagnosing, starting first line of treatment, referral, and follow-up. So these are the things which we had to do primary care psychiatry, my dear friends. That is taking mental health to the doorsteps. Thank you very much for giving your valuable time. Stay safe.